Hello, everyone. This is the wrap-up meeting for the Senate Study Committee on Violence Against Healthcare Workers. And I want to thank all the people that are joining us on Zoom. This time of the year, it's very difficult to round up everyone because of conflicts. And so we do appear to have a quorum. Do we have six? Okay, so what I thought I would do is go ahead and read the recommendations that are in the report. We did send this out to all of you by email and had not gotten any recommended changes, except I did talk to Dr. Dove earlier and he'll have something that he wants to say. But let me go ahead and just read what we have. We're aware that JCO revised workplace violence prevention requirements will be applicable to all JCO accredited hospitals and critical access hospitals beginning on January 1st of 2022. And so the study committee chose to focus its recommendations on training, screenings, and proper responses. Here are the recommendations. Number one, encourage state and local law enforcement agencies to partner with healthcare facilities and provide healthcare workers with similar training that peace officers receive, such as de-escalation, crisis intervention, and self-defense. The committee learned that several law enforcement agencies are willing to partner with or have already partnered with area hospitals to help train healthcare workers in dealing with potentially violent individuals. This training emphasizes the same de-escalation techniques utilized by law enforcement as well as some basic self-defense. Additionally, NAMI Georgia submitted a draft proposal for a one-day, 8-hour workplace violence prevention course that could be offered to all healthcare workers, covering the impact of mental health, an empathy exercise, identifying situations that lead to violence in healthcare settings, and principles of de-escalation. The second recommendation is to encourage training for all hospital staff on interacting with behavioral health patients and potentially violent patients. Number three was to encourage the training of all hospital staff, including security and de-escalation, self-defense, and response to emergency codes upon hire and annually or biannually. Number four was to encourage the use of behavioral emergency response teams, or BERTs, in each hospital. Number five was to encourage risk assessments and screenings while patients are being processed. And number six was to establish an alert system for known violent patients. So with that, that took into account the testimony that we received previously. We're not taking additional testimony today, but I'd be delighted to open it up to, I know Dr. Dove, you wanted to come in, if you wanted to go ahead and speak.
Sure, good morning.
Sorry,
good afternoon, I should say. Can you hear me? Okay, great. Sorry, I cannot be there in person here at the hospital this morning, but my concern in speaking with Senator was basically the deletion of the changes to Georgia code. When we had the initial draft recommendations from the subcommittee, they included expanding the enhanced penalties for aggravated assault and aggravated battery to cover all healthcare workers. Right now, if we follow the recommendations that are in place that were just listed, that there's still a double standard in affording protections only to healthcare workers if they're in the emergency department setting. I gave a real world example of what we see even in the emergency departments here is that we have inpatient nurses that are coming to manage patients that are in the emergency department waiting for a bed. If there was an assault that occurred on that healthcare worker because they're waiting for a bed in the emergency department, they're covered under a standard. But if that patient had a bed available and went upstairs and that staff member was assaulted, they've lost that protection. And that doesn't make sense. To me, it doesn't sit well with me, given the fact we heard the testimony from numerous individuals that were not necessarily in an emergency department setting. I'm an emergency physician. I have this protection. I do not see how we can tell healthcare workers because this is not just an ER problem, how we can tell other healthcare workers that they are not protected in the same way. So my request is that we reinsert the language that was part of the initial document, November 4th of the draft document, which was the change to Georgia code. Other than that, I agree with everything else.
Any other committee members have any comments?
Hi, it's Ashley Gresham. Can you hear me?
Yeah.
Yes. Hey, hello. Hi, good morning. I 100% support Dr. DeVay. Although I am primarily a vice president of emergency services, however, I 100% agree with him. And truly staff morale, truly retention, truly everything that he said. How am I as a provider to tell them you're only protected in the ED, yet when you go upstairs, you're not? So I 100% support everything that he said.
I will add that
Okay,
I am also in agreement. I do work more in the inpatient setting versus in the emergency department. So I do feel that all of our healthcare workers should be protected. While we do see these violent acts occurring more in the emergency department, it certainly carries over into the inpatient setting as well. So I think it should be equal for all.
Okay, I'm looking at the original potential recommendations, including proposed changes to the Georgia code. And there were 3 different things that we had discussed. One was expanding the enhanced penalties to cover all healthcare workers and ? Employees within a healthcare facility. The second one was to create a separate definition for healthcare worker. And the third was to require mandatory reporting. And we heard a lot of testimony on all 3 of these things. I think the hospital industry was not really interested in mandatory reporting for multiple reasons. The definition of healthcare worker is highly problematic because it is hard to know where that starts and stops, and whether that's just clinical folks or anyone that works for a hospital. So that's one of the problems with that definition. The enhanced penalties, we heard testimony on several aspects of that. One is that we don't have any data on that because the healthcare workers are lumped together with public safety at this point in time. There's no way to separate them out the way that the code reads. And in addition, there already are penalties in place for aggravated assault and aggravated battery, so that the prosecuting attorney's counsel and also the defense bar did not feel that enhancing those penalties was going to deter anything or change anything. So I'm certainly open to putting something in the recommendations about considering enhanced penalties. But I think as far as what the actual language would be, or whether a bill would be introduced, would remain to be seen. In other words, the committee is not introducing legislation. And so if we wanted to put something in there about considering expanding enhanced penalties, I don't have a problem with that. But I think that's about as far as we could go, since we're not going to be introducing any legislation as a committee.
I would move that we make that, that we insert that language into our recommendation to expand the enhanced penalties for item 1 from that document of proposed changes. Expand enhanced penalties for aggravated assault and aggravated battery to cover all healthcare workers, and then leave it to others to define what exactly is a healthcare worker. That'd be my motion.
Madam Chair, if you need a second, this is Senator C. I'll second it.
Okay. Any more discussion on that? I think our wonderful staff can come up with some language that would be appropriate. If you guys trust us to do that, or we can, I'd rather do that than to do it on the fly and just go ahead and approve the report pending adding that additional language that we'll craft to give the committee the flexibility and also to make a statement that we do support healthcare workers. And whatever we can do, I just can't promise anybody that legislation is going to happen or would pass if it was proposed. So if we want to recommend that be considered, I'm happy to add that to the report. Would that be acceptable, Dr. Dave?
Yes.
Okay. Okay, with that said, any further discussion? Okay, then I need to vote. All in favor, if you could just say aye.
Aye.
You may need to unmute yourself to do that.
Aye.
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 Aye. Aye.
Okay, anybody opposed? Okay, thank you. That passes. And I want to thank our staff. I want to thank Senate Press for making this happen. Legislative Council for being with us. Alex Azarian for your help on helping us draft this report, and Sky Park, who has been making sure that things operate smoothly and taking our minutes. So with that, the meeting's adjourned. Thank you very much for your participation.
Merry Christmas.
Thank you all. Merry Christmas.
Thank you all. Merry Christmas.
Merry Christmas to all.